Botox for me smoothed out the lines in my forehead, smoothed out the furrow between my eyes, kind of the frown line. It also eliminated crow's feet and helped with some wrinkles that I had underneath my eyes.
What Botox does specifically is it weakens the muscle temporarily, somewhere between 4 and 6 months. By weakening the muscle, the muscles that cause the wrinkles in the first place, the wrinkles soften. Botox works as a purified protein that affects the muscle end plate that causes the muscle to tighten up. Now if you think about what causes wrinkles, there's several things. There's gravity, there's sun, and then there's muscle hypertrophy. Muscle hypertrophy is where the muscle gets thick disproportionately and it causes different kinds of creases. The most common use of Botox is in the area called the glabella. This is the frown line. Over time the glabella muscle the muscles in the areas of the glabella get stronger and stronger, and it brings your eyebrow downwards, makes you look like you're frowning or tired, and it causes a crease, usually right between the eyes.
I decided to try Botox because who doesn't want a more youthful appearance? And I was looking tired. I would consistently hear comments like, oh, are you not feeling well today? Or, gee, you look tired. And I wasn't tired at all. So after a lot of research, I thought that Botox was a safe way to really give my face a wake-up call.
Most people that have had Botox, you'd never know it. If it was done very well, you would never know they had Botox, because what's happened is you weaken the muscles that cause the wrinkles and you left the other muscles intact. The ideal amount of Botox would be enough Botox that gets rid of the wrinkles but maintains facial expression. We still want you to be able to express yourself, we still want you to look natural, and that's the real goal. Of course you can overdo it and have a plastic looking face. That's not what anybody wants. That might be what they get into when they're going back and back and back and trying to get additional things done. The right amount of Botox gets rid of the wrinkle but maintains facial expression. And that's the perfect amount. Additionally, we want to change the brow position back to a youthful state. That's again the right amount of Botox. Too much Botox will make an unusual position brow. Too little Botox really won't have any effect on it. So the real goal is getting the right amount of Botox. The nice thing about Botox is you can do it in serial boluses. Let's say we evaluate somebody's brow and they're not really sure what they want to do. We can start out with real safe areas, which would be right between the eyes and the glabella lines. It seems that virtually everybody has improvement with just treating the glabella alone. It does elevate the brow, both in men and women, to a desirable height. It also improves the frown lines and the look of tiredness or fatigue. It improves the appearance that you're angry. Some people are worried about the plastic look or fake look of Botox. The right amount of Botox doesn't make you look plastic or fake. It makes you maintain your facial expression and weakens the wrinkles, weakens the line and improves the brow position. Most people that have Botox done by a professional, people can't tell they had anything done. They say, you look younger, you don't look so tired, you don't look so angry. That's the first thing they notice. Your eyes look more open. Did you get a lot of rest? Were you on a vacation? That's the ideal amount of Botox. The unideal amount of Botox is, what did you have done? Did you have a facelift? We really don't want you looking like that. We want people noticing that you don't look so tired, you look refreshed. A common myth in cosmetic medical procedures is that you can look 20 years younger. That's really not possible. I don't think that's realistic. Ideally, you look good for your age, or you look great for your age, or you look better for your age. But to think that Botox will make you look 20 years younger is not going to happen. Botox ideally will make you look less tired, more refreshed, make you look comfortable, happy with yourself, make you look relieved. That's the ideal amount of Botox.
When I have a Botox treatment, I typically return to work within a matter of minutes. I do notice that there are slight bumps on my forehead around the injection marks immediately following, but typically by the time I walk to my car, I don't even notice them, and without touching up my makeup or anything else, I simply return to work and it goes unnoticed.
We're always worried about side effects. When you look at medications and treatments for cosmetic concerns, there's risk and there's benefit. The benefit is improving your wrinkles, softening your wrinkles, making your face look younger, healthier, making you not look so tired. Adverse events of Botox are very rare. Headache can occur, dry mouth, that's usually 2 or 3 days. Patients usually don't complain about this because it's so mild. I don't hear about that much. The most serious reported effect of Botox that we've seen has been hitting the wrong muscle. When the doctor injects it, if it inadvertently goes into the wrong muscle, that muscle will weaken. And you hear about what's called ptosis, where the eyelid might droop. When that occurs, that will wear off. It'll wear off in 3 to 6 weeks and it'll go away. So even the worst case scenario with Botox wears off.
Having a procedure like Botox has given me a rejuvenated look and a rejuvenated feel. I have also had Dr. Moak put some Restylane, some filler underneath my eyes, and I'm very happy with how that turned out. I firmly believe in fillers and peels and anything that will make you feel better about how you look. I have actually had several procedures performed by Dr. Moak, including mesotherapy and hormone replacement therapy. I think by the time I'm finished, I will have had most of the procedures that they offer.
Botox can be combined with any other procedure. Turns out nothing interferes with Botox. We do Botox on the same day that we do thermage, the Fraxel resurfacing procedure, the same day we do fillers, and it seems to augment any other procedure. Surgeons have found that when you do facial facelifts, leptoplasty, which is an eye lift, and forehead lifts, that they use Botox to get a better result, and that's simply because you're weakening the muscle that caused the problem in the first place. We frequently find patients that have a specific concern. They want to resurface their skin because they have brown spots or pigment irregularities. They're interested in thermage to pick up some laxity in their skin. And we might tend to neglect the muscle if we don't really look at it and examine the face. The muscles cause facial wrinkles in many cases, particularly the muscles over your eye, the glabella, the forehead lines, and the lines around the sides of your eyes. If you don't treat those lines, no matter what you do for resurfacing the face with a filler, with any kind of facelift, with any kind of non-surgical facelift, the wrinkles will come back quicker if you don't use Botox. The Botox corrects the underlying problem, which is the muscle.
The key really is finding a doctor that is as committed to your health and well-being as you are. And in meeting Dr. Moak and his staff, I really feel that they embody that idea with all of their patients, and it makes a big difference.
Fillers are a very safe cosmetic procedure. These are one of the most common cosmetic procedures done in America, and I think they'll continue to grow as we're getting better and better quality of filler materials. Fillers are designed to take up space or to fill in defects or wrinkles. And when we look at the anatomy of the wrinkle, step one is the skin. If there's small creases in the skin, fine lines in the skin, large pore size, irregularity of the skin has to be resurfaced or somehow treated to soften the appearance of the skin. Underneath the skin you have bones, muscles, and fat. And as those structures change over time, you get defects. You get dropped in areas where it might be a deep wrinkle or crease. A common example would be the marionette line or the nasolabial fold, the fold between the eyes, a little divot between the jowls, or sagging jowl. All these things are undesirable. The ideal filler will have an intermediate durability, intermediate amount of time that it'll last. We'd like a filler that lasts somewhere between 5 months and a year and a half, 2 years. That's the perfect filler. This way, you're satisfied with the results, and even though you have to redo it. But on the other hand, the filler breaks down in time. So if there's something you're not happy with, it goes away. That's number one. And secondly, it always feels natural. And as your skin changes and your structure changes, the filler goes away and it can be redone. That's the ideal filler. Permanent fillers have significant consequences. A permanent filler is a filler that's made out of some synthetic substance that your body won't break down. Well, they feel unnatural. And as your skin changes and your bone structure changes, you can start seeing those fillers. We don't really want a permanent filler, even though you might just want to do this one time. That's not practical. You want to have a filler that breaks down in time and changes with your changing face. One exciting new procedure is fat augmentation to the face. Fat might be the most perfect filler because it will go away in time, probably 5 to 7 years, and it's something that's natural, it's found in your own body. Fat is taken out of some other area that you feel you can spare fat, like your legs or your stomach, and it's gently injected into the muscles of your face. What this does is it restores your face's volume. Fillers are placed with needles. They're usually tiny needles, much smaller than you use to draw blood. In general, we do a nerve block so you can't feel the filler because sometimes there would be some discomfort with injecting the filler without a numbing medication. Aftercare instructions for fillers are quite simple. You want to avoid vigorous massaging of your face, but gentle massaging is okay. You might want to sleep on a couple raised pillows for the first couple nights. That way you have less swelling.